Hi, my name's Dr. Adam Fox and I'm a consultant paediatric allergist at St Thomas's Hospital's Children's Allergy Service. I'm going to be talking about the different types of food allergy that we see in children. Food allergies are a problem with the body's immune system when it wrongly recognises food as being something harmful and reacts inappropriately to it. We now understand that there are two different types of food allergy, and this relates to the different parts of the immune system that cause the reaction. The first type, and the type that we understand the best, are called IgE-mediated food allergies, also known as immediate food allergies. These are the allergies that cause reactions almost as soon as you eat the food. It's very rare for it to be more than about 10 or 20 minutes before you get the reaction. And the reaction usually involves itchiness, hives or swelling around the mouth, and if you're very unlucky, it may cause a severe or potentially life-threatening reaction that we call anaphylaxis. The other type of food allergies are called non-IgE-mediated food allergies, and we don't really understand as much about them as we do about the immediate type allergies. They're often referred to as delayed food allergies, and sometimes people refer to them as intolerances, which can lead to some confusion. Delayed allergies involve the slow-acting part of the immune system, and typical symptoms include things such as eczema, colic, reflux, diarrhea, faltering growth, all of which are typically found in young infants. There are a number of ways that immediate and delayed food allergies are different. One of the ways is the type of foods that tend to cause them. Immediate allergies are commonly caused by milk, egg, nuts, and other foods such as fish, wheat, sesame, kiwi, for example. Delayed allergies are most commonly caused in infants by milk or soy. It is possible to get delayed allergies to other foods, but this is much more unusual, and they can be things such as rice or wheat or egg. The most obvious way that immediate and delayed food allergies are different is how quickly they show themselves. Immediate allergies, the reactions happen very quickly after the food's eaten, whereas with delayed allergies, they don't. They can take hours and even sometimes days for the symptoms to appear. More commonly, however, with delayed allergies, it's a chronic problem that goes on and on because the infant is still having the food that's a problem. So typically it would be an infant having cow's milk based formula in their diet, or because the mum is having cow's milk in her diet, getting cow's milk through the breast milk, and they get chronic symptoms such as eczema or tummy problems such as diarrhea or colic or reflux. One of the important ways that immediate and delayed food allergies are different are in the way that we make a diagnosis. With immediate food allergies, it's usually very obvious that there's a problem because of how quickly the food causes a reaction. But in order to confirm that there's an allergy, we might do an allergy test, such as a skin prick test or a blood test. And when this is positive, it can help confirm that there's a problem. With delayed allergies, because it's a different, slower acting part of the immune system involved, it's not so obvious if there's an allergic reaction happening. However, if it's suspected, unfortunately, our skin tests or blood tests don't really work here. Those tests are designed to look for the immediate allergies, and usually they'll be completely negative in a child who has a delayed allergy. Because the allergy tests don't work so well, we have to rely on our clinical history, so the story of what happens with that patient, in order to work out if we think there's a diagnosis of a delayed allergy. When we think that there is, then the test that we can do to confirm it is to eliminate that food from the child's diet. So in practice, that would mean cutting milk out of mum's diet if she's breastfeeding, or if it's an infant where we suspect a milk allergy, changing their formula so that they don't have milk in it anymore and replacing it with a non-milk based hypoallergenic formula. If there is a delayed type milk allergy, then the symptoms should all get better within 3 or 4 weeks. And at the end of that period, in order to be sure that it was because of the milk that things got better, we'd reintroduce that formula back into the diet to confirm that the symptoms return again. It's only when we're able to demonstrate that things get better off milk and then worsen again back on milk that we can confirm that there is indeed a delayed type allergy. There are also important differences in the ways that these food allergies are managed. Because they're potentially dangerous, immediate allergies require our patients to carry around antihistamines for emergencies and sometimes adrenaline pens, such as EpiPens or Jex, because there's a risk of having a severe reaction. With delayed allergies, there isn't such a risk, so there's no need to carry around emergency medication. Reactions can be very unpleasant and can cause symptoms such as vomiting and diarrhea and breakouts of eczema, but they're not dangerous and they can't be life-threatening. Another important difference between immediate and delayed allergies is how long they last for. Delayed allergies tend to go away sooner, and most children have outgrown them within 2 to 3 years, although of course there's always a few children who may have their allergies that last for a little bit longer. With immediate allergies, how long they last for will very much depend on what it is that they're allergic to. Many children with milk or egg or soy or wheat allergy will outgrow them as young children, whereas children with immediate allergies to peanuts, tree nuts, fish or shellfish tend to have these for most of their lives, with only a few children outgrowing them. In summary, there's 2 different types of food allergy. The immediate food allergies, which cause rapid reactions involving itchiness and swelling, which can be potentially life-threatening. Whereas there are also delayed allergies that involve the slower part of the immune system that cause more chronic symptoms such as eczema, loose stools, reflux, and colic, and tend to affect young infants and are usually related to milk allergy.